direct immunofluorescence in renal pathology. So coming to this topic, we discuss about the findings on light microscopy, immunofluorescence, and electron microscopy. On light microscopy, basically it is demonstrated by the hemotoxin eosin stain and some special stains like silver and periodic acid stain. Hemotoxin and eosin stain interprets for the cellularity, base membrane thickening, mesangial size, which is whether it is increased or decreased. Silver and past stain also demonstrates about the base membrane abnormalities. Remember, on light microscopy, we do not comment about the dipoids. Coming to the immunofluorescence, it is directly targeted by glomerulus by fluorescent green or black background, and its deposition like immunoglobulins like IgM, IgG, IgA, and complements like C1q, C3 are targeted by the fluorescence label antibodies, and pattern of immunofluorescence can be noted. Remember, the location of dipoids cannot be demonstrated on immunofluorescence, where the pattern of dipoids can be demonstrated on immunofluorescence. On electron microscopy, only the shades of black, grey, white are mentioned, where the location of dipoids like subepithelial, subendothelial, mesangial are commented on the electron microscopy. So the actual location of dipoids can be known by the electron microscopy, whereas on immunofluorescence the pattern of dipoids like linear granular dipoids can be known. On DIF, it is on direct immunofluorescence, we comment upon the immunoglobulins deposition such as the immunoglobulin A, immunoglobulin M and G, whereas on complement protein demonstration can also be done on renal immunofluorescence, which are of C2 complement proteins, that is C3 and C1q. Fibrinogen deposition on renal immunofluorescence can also be noted, and light chain deposits like kappa and lambda light chains depositions on renal immunofluorescence can also be demonstrated. There is a checklist for renal immunofluorescence. First, we don't know about the dipoids can be seen on renal immunofluorescence, such as the immune complex dipoids can be seen, or antibody dipoids can be seen or not. And the dipoids, whether the linear or granular or absent, can be seen on the immunofluorescence, which are of the capillary loops, mesangium, or both. That is, these linear or granular dipoids on renal immunofluorescence can be seen around the capillary loops, can be seen on the mesangium between the capillary, which is location which is present between the capillary loops, or can be seen on the both sides. So this is a picture showing the linear and granular renal immunofluorescence, where the linear immunofluorescence shows continuous ribbon-like dipoids along the capillary loops, and the granular renal immunofluorescence shows discontinuous irregular coarse dipoids, which are also seen on the capillary loops. So this is the detailed explanation about the linear renal immunofluorescence, where the ribbon-like continuous dipoids are seen along the capillary loops, which is most commonly seen along in the Goodpasture syndrome condition. Where it is about the granular renal immunofluorescence, where it is the renal immunofluorescence deposition seen along the capillary loops, but here the dipoids are irregular, discontinuous. And is also the granular renal immunofluorescence, where the dipoids are seen along the mesangium, and the dipoids here are coarse. Renal disease can be nephritic or nephrotic. So here, in any nephritic or nephrotic renal condition, we have to note about the location of disease activity, pattern of immunofluorescence. DIF is positive for. Where is this DIF positive? So in Goodpasture syndrome, location of the disease activity is around the glomerular basement membrane. Pattern of immunofluorescence is linear. DIF is positive for immunoglobulin G mostly, and the DIF is positive along the glomerular basement membrane. Coming to the IgA nephropathy, also known as Burgess disease, do not confuse it with the Buerger's disease, which is also known as thromboangiitis obliterans. Here in this condition, the location of disease activity is in the mesangium. Pattern of immunofluorescence is granular. DIF is positive for IgA mostly, and here the DIF is positive along the mesangium. The above conditions are also noted in a condition which is systemic vasculitis, also known as Henoch-Schönlein purpura, also known as IgA vasculitis. Lupus nephritis. In this condition, the location of the disease activity is in the subepithelial, subendothelial, mesangial, where the pattern of immunofluorescence is granular. DIF is positive for both the complements and all three immunoglobulins, and DIF is positive along the capillary loops and mesangium. So this is known as the full house immunofluorescence, which is seen in lupus nephritis condition. MPGN, that is type 1 MPGN, that is membranoproliferative glomerulonephritis. In this condition, the location of disease activity is along the subendothelial region than mesangium. Pattern of immunofluorescence is granular. DIF is positive for C3 complement protein mostly, and the DIF is positive along the capillary loops and the mesangium. Coming to the membranous nephropathy, here the location of disease activity is along the subepithelial. Pattern of immunofluorescence is granular. DIF is positive for immunoglobulin G than C3 mostly. DIF is positive along the capillary loops. Post-streptococcal glomerulonephritis condition, where here the location of disease activity is also subepithelial. Pattern of immunofluorescence is granular, which is very coarse in nature. DIF is positive for immunoglobulin G than C3 mostly, and the DIF is positive along the capillary loops, which is known as the starry sky appearance on renal immunofluorescence. Do not confuse with starry sky appearance on H&E stain, which is most commonly seen in non-Hodgkin's lymphoma such as Burkitt's lymphoma. Thank you.